I want to introduce Dr. Takashi Wada from the Pasadena Public Health Department. Dr. Wada.
Sure, thank you. Good morning. My name is Dr. Takashi Wada, T-A-K-A-S-H-I. Last name is Wada, W-A-D-A. I'm the Director and Public Health Officer for the Pasadena Public Health Department. We are one of only two fully independent city-based health departments in Southern California, Long Beach being the other, but we work closely with Los Angeles County and Long Beach to coordinate our efforts, and we're in full agreement with the H1N1 vaccination strategy previously outlined by Dr. Fielding. After this weekend, Pasadena will also be shifting away from large-scale mass vaccination efforts and really focusing on providing vaccine through our safety net clinics, as well as getting the vaccine out through private medical providers. Personal health practices are certainly important, covering the cough, washing hands, staying home when you're sick. But vaccinations are really the best tool that we have as public health practitioners to prevent and control the spread of infectious diseases like H1N1. Fortunately, recent data seem to indicate that H1N1 activity is decreasing across the country and here locally, but historically, pandemics tend to come in waves, so we need to stay vigilant. In Pasadena, we've also seen a decreased number of cases over the last couple weeks. Fortunately, we've seen no deaths, but of course, as we all know, over the next several weeks, we'll be seeing several hundreds of visitors to Pasadena and surrounding communities as we prepare for the New Year's activities. This year we have, of course, the Rose Parade, the Rose Bowl football game, as well as the BCS Championship game. Many of those visitors and participants will be coming in, a number of youth and children as well, and staying in close quarters, living in or staying in hotels and or with family and friends, and this can more easily lead to spread of infectious diseases. So again, we're encouraging everyone, not just local residents, but also holiday visitors and participants in the New Year's activities, to get the vaccine as soon as possible. Just as a reminder, it takes a couple of weeks after receiving the vaccine to build up the immunity as well. Children under age 9 and under need to receive 2 doses of the vaccine separated by a month. So again, in order to be protected for the holidays, we're really recommending that everyone get vaccinated as soon as possible in the next week or two. In conclusion, H1N1 is not going away. There have been almost 400 deaths in California, and so we need to stay prepared. We'll be working very closely with our community providers as well as our partner agencies like Los Angeles County, Long Beach, and the state to coordinate our efforts and get as much vaccine out to the public as possible to really protect everyone as we all face H1N1. Thank you very much.
Thank you, Dr. Wada. Dr. Wada, I want to point out that one of these clinics is at the Rose Bowl, and it's the only time when everybody who comes to the Rose Bowl, assuming they're in a high-risk group, can be sure that they're a winner.